Welcome to another episode of Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. This is where we discuss, this is where we dissect important health-related topic that matters to everyone. My name is Amazing Rita, and with me in the studio is
Dr. Dimba Favor.
Hi, Dr. Favor.
Hello, Rita.
All right, today we'll be talking about liver cirrhosis and how alcohol and lifestyle can actually cause liver cirrhosis in your body. This is a condition that affects your liver. And you know that your liver actually helps in detoxification in your body. It's not that thing you have been drinking that they mix for you. So let me ask Dr. Favor. Dr. Favor, what is liver cirrhosis and how does it affect the body?
Liver cirrhosis is a situation or a condition that occurs when the liver cells, the hepatocytes, we call the liver cells hepatocytes, when they are replaced with fibrous tissue. And then this replacement does not just occur on its own. It occurs when there's been an ongoing defect happening in the liver. This defect has happened over time, and now the liver is not able to heal itself because the liver, they call it a self-regenerating organ. So when the liver is no longer able to heal itself, cirrhosis occurs. So I said cirrhosis is when the hepatocytes, that's the liver tissues, have been replaced by fibrous tissue. And it's an irreversible condition.
Oh my, irreversible. That's if the liver could not help you, say maybe it has gone past an early stage.
Once it gets to cirrhosis, cirrhosis is irreversible.
Tell me, normally, how does the liver function?
There are many functions of the liver, a lot. The liver is one of the most important organs in the body. People say the liver is the largest organ in the body, but no, the liver is not the largest organ. The largest organ in the body is the skin, but then the liver is very important. One of the things the liver does is detoxification. You know, all this nonsense we take, even toxins, things that are toxic to the body, even some drugs, the liver's function, one of the liver's function is to detoxify them. Then the liver also helps there's what we call stellate cells inside the liver. So it helps to produce vitamin A. The liver equally helps to produce lipids. Some lipids and then some proteins, like albumin now. The liver is what produces albumin. Yeah. Then the liver equally helps in storage of fats. Fat and glucose. That's why when someone is in a state of fasting, like someone has fasted or has starved for very long, gluconeogenesis starts taking place. Gluconeogenesis is when there is breakdown of this glucose that has been stored in the liver. So when the person has starved for a long time or is fasting, the liver will start undergoing, would induce gluconeogenesis so that glucose can be released to other parts of the body. Then we have some other things take place in the liver, like urea cycle. That's urea, like when you want to break down urea so that ammonia will not be released into circulation because ammonia is toxic to the body. So in fact, I want to place this under detoxification. Then the liver also helps because the bile ducts, they are somehow, I won't call them part of the liver, but they're somehow embedded in the liver, yes. So it helps with emulsification of fats. That's bile. But like I said, the gallbladder, the bile ducts, the hepatic duct, and the cystic ducts, all those things, they're somehow connected, the liver. Yes, then the liver also helps with some kind of storage of fat soluble vitamins. So these are some functions of the liver. But like I said, the liver is a very important organ in the body.
So what is the main cause of liver cirrhosis?
There are different things that can cause liver cirrhosis, different things. First of all, viral infections. You know, the hepatitis B and C we talk about is a type of viral infection. So it's one of the things when it's not managed from an early stage. In fact, it's not even managing it properly. First of all, it's picking it up early. If you're able to pick it up early and then manage it properly, it won't get to cirrhosis. But if not so, if you pick it up late and then poor management, it can cause cirrhosis. We also have chronic alcohol abuse. Chronic alcohol abuse is one of the first or leading causes of liver cirrhosis. Then apart from chronic alcohol, we also have non-alcoholic fatty liver disease. Yes, so this is one of the things when you see people who go to check their fasting lipid profile, they want to check their cholesterol. The liver is one of the places you can go and accumulate. Another cause is some people have some genetic malformation that can affect the liver. Something like there's something we call there's a situation where a condition we call Wilson's disease. In Wilson's disease, copper accumulates in the liver, and the reason is that there's a genetic mutation in the gene that's supposed to clear copper from the liver, but now somebody having this genetic mutation, the copper cannot be cleared out from the liver, so it accumulates in the liver and then it gets toxic to the liver. Another thing is some people have autoimmune diseases. Autoimmune means like the body's immunity is fighting itself. Exactly. So some people have autoimmune diseases. So these are some things that can lead to cirrhosis over time. Yeah.
Explain to us specifically how alcohol damages the liver over time.
Okay. Chronic alcohol use, when, like I said, detoxification is one of the functions of the liver. So when there's chronic alcohol use, normally there's alcohol dehydrogenase. It's one of the enzymes that breaks down alcohol. But then when you abuse alcohol over time, the metabolites tend to accumulate and then they get toxic to the liver. And I even forgot to mention one of the causes of this cirrhosis is also chronic paracetamol use. As simple as paracetamol is, it's very harmful when it's abused. It can be harmful to both the kidney, the liver. Yeah. So when the metabolites are not excreted from the liver, they pile up in the liver and then they become toxic to the liver, thereby destroying the hepatocytes.
So can lifestyle and diet, can it contribute to liver cirrhosis?
Yeah, it can. Where diet falls into is the non-alcoholic fatty liver disease. It's people that eat a lot of processed things, a lot of carbonated drinks, a lot of suya, a lot of unhealthy fats. Yes, they are at risk of non-alcoholic fatty liver disease. Then lifestyle. Remember, we're always talking about the sedentary lifestyle. Sedentary lifestyle can tilt someone to hypertension. Hypertension can equally affect the liver because it has a way of translating. When hypertension occurs, then it will affect the heart. From the heart, it can affect portal circulation and what have you. So that's the way unhealthy lifestyle and then poor diets can affect the liver. But not just from that, another thing is some things we consume. Like now, fecal oral, like something you take through your mouth is one of the ways through which hepatitis A can be contracted. That's one of the viral causes of liver cirrhosis. However, hepatitis A most times is self-limiting, but then if not handled properly, it can transmit and it can progress further.
Okay.
Yeah.
Since we are saying alcohol, like puts you at the risk of liver cirrhosis, some people will be thinking maybe it's a male or man kind of disease. It's now gender based. So I want to ask, is it just men that are prone to liver cirrhosis, or both men and women?
Both gender. The reason is this: even if now we're trying to concentrate on alcohol, remember I gave a list of things that could cause liver cirrhosis.
Yes.
So it's not just alcohol.
Oh yeah.
Anybody could come down with hepatitis.
Yes.
Anybody could be born with an autoimmune disease. Anybody could be born with a genetic disorder. And anybody could have the non-alcoholic fatty liver disease.
Yeah.
But then coming to alcohol now, since that's where our emphasis on, normally there's a guideline that says consumption of greater than 21 units of alcohol per week for males, and then consumption of greater than 14 units of alcohol per week for females can tilt like a chronic, not just like you see a patient now, maybe a male that is consuming more than 21 units this week, and then
They're
stops
nothing
to consume for
for
a
1 month.
long duration, and then you say that person is at risk of
Chronic.
cirrhosis. No. For someone who is
Chronic.
chronically, I mean continuously,
Always.
consecutively, yes, for a very long duration,
Mm.
consuming greater than 21 units in males and then 14 units in females weekly, that person is at risk of cirrhosis. Remember, when we defined cirrhosis, we said it's not something that just takes place over
Gradual.
time. Exactly. Like the precipitating factor, the thing that is causing it must have progressed
Over
gradually.
time.
Exactly.
Okay, since we are talking about time, how long will it take for a chronic alcohol user to come down with liver cirrhosis?
It's not a fixed duration of time. Yeah, it depends on other factors. Most times, though, they use a range of 10 to 20 years, but like I said, it's not a fixed duration. It depends on other factors. Someone who has other comorbidities, like someone who is already diabetic, hypertensive, having other issues, health challenges, that person would come down faster with cirrhosis than someone who is still intact but just consuming alcohol or some other thing. Yes, that's one. There's someone who is already immunodeficient.
Yes.
Like I said, someone on prolonged use of steroids, someone on chemotherapy would come down faster. Someone already having, like now, a cancer that can metastasize and has started affecting the liver, and then the person is still consuming alcohol, this person will come down faster with cirrhosis than someone who is just strictly taking alcohol. So like I said, a range of 10 to 20 years. However, it depends on other factors. Yeah.
Okay. Now, for someone that probably is affected with liver cirrhosis, what are some of the symptoms they'll see?
Okay.
Or they'll notice?
For cirrhosis now, remember I said it's over time. It's not an acute event. Like it's not something that will just occur right away. So over this time, the liver will start giving some signs, some symptoms, gradually until it progresses to cirrhosis. So some of the early symptoms you could see: generalized weakness, malaise. Person is just feeling unwell. Person could have weakness. The person could have sometimes abdominal pain, because when it starts gradually and as it's progressing, maybe the liver will start enlarging, getting bigger than normal, causing abdominal pain. Then when it further progresses, the person can start having things like ascites. Ascites is you see some people, their stomach is abnormal. Their stomach is usually abnormally big. That does not mean that everybody you see with a big stomach is having liver pathology. Yes, but this for people having liver pathology that is causing that big stomach, there's accumulation of fluid.
Fluid.
Yes, in the stomach. That's what's causing that extremely large abdomen. You see some people coming down with pedal edema. Their legs will be very swollen. Then you see jaundice. The eye, the sclera, the white part of the eye gets very yellow. The skin gets unnecessarily yellow. This is jaundice. You see some people will now start having easy bruisability. Any little thing, they're already bruised and then bleeding. They're already bleeding. This is because the liver is no longer able to produce those clotting factors that it produces normally. So when there's a little injury, this person is already bleeding excessively. So these are some things. Then when it progresses further, the person can have what we call spider angiomata. This is one of the things you see, and then you know this person is already having encephalopathy. This is when the cirrhosis has advanced further. You see the person having spider angiomata. You see some men who have gynecomastia, they'll have big breasts. Some men who have testicular atrophy, like the testicles will start shrinking. Some people will have erythema on their palms. You see redness on their palms. So these are some other symptoms you see when the cirrhosis has progressed to encephalopathy.
All right, so you talked about the bloated stomach.
Yes.
You mentioned some of the things that shows that the liver cirrhosis has advanced into a
encephalopathy.
Yes. Okay, so are there some other complications that can arise from untreated or ignored liver cirrhosis?
Remember I said cirrhosis is irreversible.
Yes.
And once it gets to cirrhosis, you cannot treat it again. What you can do is just to manage the symptoms or you will do a liver transplant.
Okay.
However, it cannot be treated at that point. That's the cirrhosis in itself. Yes, there are some other things, symptoms you would see in someone with cirrhosis, apart from the ones I've mentioned earlier. There could be portal hypertension. Portal hypertension, when the portal drainage, the portal vein is it's now having a backflow of blood. So it will cause vasodilation in other vessels. Yes, in other vessels. And then this will cause release of nitric oxide. Okay, I want to use a layman's term. There could be portal hypertension. Like I said, there will be ascites. Portal hypertension is what will explain this ascites better. But ascites is when there's accumulation of fluid in the stomach.
Okay.
There could be edema. Edema is when the legs get very swollen. This thing can further progress to liver cancer. It can progress to liver cancer. And then there could be encephalopathy, where the person is now behaving like a mad person, talking irrationally. Person is having insomnia, is not able to sleep. At that point, you call it encephalopathy. These are some other things, complications you can see from liver cirrhosis.
Okay. Tell us some tests that can be done to diagnose liver cirrhosis.
For tests, you can start from blood tests.
Okay.
Blood tests, you want to do a liver function test. You want to check the transaminases. You want to check those how do I put it now? Those enzymes that the liver produces. You want to check if they are higher than normal. That's one.
Okay.
You can equally do a full blood count. In a full blood count, you want to check the level of the white blood cells to know, because sometimes when this fluid accumulates in the stomach, it could cause what we call spontaneous bacterial peritonitis. That's like the fluid accumulates in the stomach, but now how do I put it now? Like it's now getting, it's just like it has gotten infected. That fluid has gotten infected. Yes, and then it will now cause ongoing infection in the whole of the body, further bringing this person down. So you want to do a full blood count. In that full blood count, you're majorly concerned with the level of white blood cells. You want to also do a clotting profile, because remember I said the liver is what produces the clotting factors. So clotting profile will tell you if these clotting factors are deranged. So these are some blood tests you can do.
Okay.
Then you want to move to imaging. In imaging, you want to do an ultrasound. An ultrasound to tell you, in fact, from your physical examination, you can start seeing some of these signs. However, what you asked is for investigations. You want to do some imaging. You want to do an ultrasound to show you if the liver is enlarged, bigger than normal. It will equally show you the type of tissues that are now in the liver, if they have started being replaced with the fibrous tissues we talked about.
Okay.
You also want to do a CT scan. A CT scan will show it better.
Okay.
Or an MRI. But the definitive thing we use for diagnosis is a liver biopsy. A liver biopsy, you want to collect some tissues from the liver and then send it for histology for it to be tested.
Okay. For someone that has been diagnosed of liver cirrhosis, are there some food that they would no longer, like they will have to avoid? You said it can only be managed at this point.
Yes, the symptoms can just be managed, but it cannot be treated.
Yes.
Except they want to do a liver transplant.
Yeah. Okay, so are there things that they should be doing and things that they should not be doing? Let's not limit it to just food. For someone that has been diagnosed of liver cirrhosis.
Yeah, there are things the person should do and things the person should not do.
Okay.
Like for someone who has already been diagnosed of liver cirrhosis, the person will need a lot of fruits and vegetables.
Okay.
Because some of them, like I said, they contain antioxidants. And then you will need a lot of antioxidants, so you can easily get them from fruits and vegetables. Then the person there's some proteins we want to avoid in a patient with liver cirrhosis. Then also some unhealthy fats. Remember, non-alcoholic fatty liver disease is also a cause of liver cirrhosis. So imagine someone whose liver cirrhosis is secondary to chronic alcoholism. The person will not want to compound it by eating a lot of unhealthy fats because it can equally make remember, non-alcoholic fatty liver disease is also one of the causes of cirrhosis. Yes. Then the person will want to take a lot of water, and stay hydrated.
Hmm.
Person, it's also very advised for the person to stick to medications. There is a patient we once saw that had liver cirrhosis. And then this patient was saying he does not want to use the toilet. The reason is this: he felt his feces was foul smelling, like was very smelly, and then he was constipated. So he said he feels so much pain when trying to push out the feces. So for this reason, he didn't want to use the toilet. But then it's very important. The reason for someone with liver cirrhosis to use the toilet, the reason is this: if those feces accumulates in the colon, the gut organism, that's the microorganisms normally in our gut, they are going to break down these feces, further releasing ammonia, which will worsen the encephalopathy. So we want them to use the toilet as much as possible, so they can excrete the feces, so it's not broken down by gut organism. And people with liver cirrhosis, usually they have constipation. So one of the things we give them is we give them lactulose that will help them pass feces. And not just pass feces, what it will do is that it would help them pass out a lot of the ammonia. Yes, it would help them pass out a lot of the ammonia. So sticking to their medications, being compliant with their medications is one of the things we encourage them to do.
Okay, so for someone who you said it cannot be treated, it can be managed, but there will always be that Baba something or Mama something that would advise that somebody to go and start doing herbal medication, taking herbal drug. Now, what is the implication of taking herbal medications
with someone with
yes?
That's very risky. Remember, I told you one of the functions of the liver is detoxification.
Yes.
So these herbal medications, even if it comes into the body, what's going to detoxify it? So it would accumulate and further worsen it. So it's very unadvised if there's anything like that.
Okay, so lastly, before we go, for people who they're trying to check their liver, for those who they're trying to, what are the things that we can do to prevent, that is for people that are not diagnosed of liver cirrhosis.
Okay, their liver is still intact.
Yes, things that we can do to prevent this, so that we know that we don't put ourselves at the risk of cirrhosis.
All right, there are a lot of things to do. Healthy diet, one. Avoid as much as possible excessive consumption of alcohol, because it's not like alcohol is really giving anything to the body. So why will someone know that this is detrimental and then even take it excessively? Do you understand? So avoid excessive consumption of alcohol. Regular screenings, because like I said, it's not just promiscuous lifestyle that puts someone at risk of contracting these viral infections. Even a health worker, not even when you go to have your hair cut, all these things, they put someone at risk. So it's wise and then important to go for regular screenings or checkup. Then equally, like I think we had one session where we discussed some investigations someone should go for regularly, just to keep fit. So a liver function test. Yes, just once in a while you could go for a liver function test to check how well your liver is functioning. Yeah, so these are some lifestyle modifications: a lot of water, a lot of fruits and vegetables. Like I said, the number one point was healthy diet.
Yes.
So they consume a lot of water, staying hydrated, a lot of fruits and vegetables would help achieve this.
Yeah, thank you so much, Dr. Favor. So you heard from Dr. Favor, and do not forget that this liver cirrhosis cannot be treated once it has gotten to cirrhosis. So early detection, we always say, is key. But even before the early detection, you can always do things that prevention is the best medicine. Just prevent whatever, because while you are trying to say I'll catch it early, you don't know, probably it has started advancing and you won't even know. By the time you finally understand what is happening to you, it's late. And liver transplant is not small money.
It's not even about the money. the failure rate.
I'm telling
the
you,
money.
your body self can even
the-
reject it.
Exactly. And then, one of the early symptoms we said is malaria. You just be feeling unwell.
Well,
So you won't even know where that is
coming
coming from.
from
You may just assume within yourself, this is malaria.
malaria.
Not knowing that something is actually happening to
Then
the
you
liver.
are
That's why
downing
prevention,
paracetamol,
which is now
destroying
destroying
the
the
liver.
liver.
So just try as much as possible. I will always preach it that if you feel somehow, it is better you see a doctor.
Yeah.
Tell a doctor. And between me and you know that once we see a doctor, treatment is always easier.
Exactly.
And all the money you've wasted, that one is just gone. So it's always easier, better, safer to see a doctor before
Yeah.
anything. And please make sure for those who are chronic alcohol consumer, please, ejo, just try to limit it.
Yeah.
Limit it, because it's one bottle, but you don't know what that one bottle is doing inside of your body. And till we come your way again, this has been Health Unplugged, brought to you by Life for Medical Diagnostic Hub. We just talked about liver cirrhosis. And don't forget to like, share, drop a comment or a question for us in the comment section. My name is Amazing Reader.
And I'm Dr. Dimba Favor.
So from me and from her, it's bye.